Hello, my name is Hailey Volk, and today I'll be discussing my research that I have conducted with Dr. Jennifer Ablow and Dr. Eleanor Sullivan about the influence of prenatal nutrition and supplementation on birth outcomes and negative affectivity in infants. During pregnancy, variation in nutrition, maternal body size, and exposure to toxins can exert powerful effects on the developing fetus that impacts the child's lifelong health through the alteration of embryonic, fetal, and placental growth and development. This can predispose the fetus to more adverse birth outcomes and long-term health complications like cardiovascular disease, obesity, type 2 diabetes, and cancer. A potential avenue to improve fetal outcomes and development is the reduction of maternal inflammation during gestation. It is believed that during pregnancy, the maternal immune system is altered significantly, increasing the concentrations of macrophages, neutrophils, and serum cytokines. The immune system response during gestation must maintain a delicate balance to ensure a healthy maternal-placental interaction throughout gestation. Obesity induces chronic, low-grade bodily inflammation and could potentially couple with existing inflammation during pregnancy, thus altering this delicate balance and creating harmful conditions for the fetus and mother. One way to examine inflammation during pregnancy is through diet and supplementation. The typical American diet is characterized as a Western-style diet and is defined by increased consumption of red meat, fat, and simple carbohydrates, causing pro-inflammatory serum cytokine concentrations to increase. Additionally, fetal exposure to improper prenatal supplementation causes nutritional deficiencies during gestation, leading to more adverse birth outcomes and changes in neurodevelopment. As pregnancy already induces a state of inflammation in the body, the interplay between obesity, pregnancy, diet, and the developing fetus could give insight on how to reduce costly complications and adverse developmental outcomes. In order to explore this relationship, we looked at women who are already participating in the Prenatal Environment and Child Health Study, or PEACH study, at OHSU. Participants completed a visit during the second and third trimesters where they had their body composition measured using a bod pod, completed a supplement questionnaire, and submitted photos of their supplement labels. In addition, after each of their visits, participants completed 3 random 24-hour food recalls via a phone interview that were used to calculate their Dietary Inflammatory Index score, or DII score, for the second trimester, third trimester, and an overall average score throughout their pregnancy. Postnatally, we obtained birth outcomes from participants' medical records, and they completed the Revised Infant Behavior Questionnaire, or IBQR, 1 month postpartum. The results from this analysis indicate that decreased DHA and EPA supplementation, 2 types of omega-3 fatty acids, in the second and third trimesters were associated with increased APGAR scores at 5 minutes. The APGAR score stands for appearance, pulse, grimace, activity, and respiration, and provides an accepted and convenient method for reporting the status of newborn infants immediately after birth at the 1-minute and 5-minute time point. We also found that increased iodine supplementation in the second trimester was associated with higher APGAR scores at 5 minutes, but the inverse was seen with third trimester iodine supplementation. There were no statistically significant results between the other micronutrients and birth outcomes that were examined. When looking at the DII, we found that an increase in third trimester DII, a more pro-inflammatory diet, is associated with higher APGAR scores at 5 minutes, and an increase in pregnancy average DII is associated with higher APGAR scores at 5 minutes as well. However, the DII was not significantly associated with BMI or fat mass during the second and third trimesters. Lastly, we found that increased third trimester folic acid supplementation is associated with increased negative affectivity scores as determined by the IBQR as shown in Figure 1. Negative affectivity can be characterized by distress and irritability and is defined by the IBQR using scales of sadness, fear, distress limitations, and falling reactivity. Our results add to the growing body of literature that supports the impact diet and supplementation can have on birth outcomes and infant development. APGAR scores between 7 to 10 at 5 minutes are indicative of good health at birth, and our sample scores range from 5 to 10 with a mean of 8.87. Since the data is concentrated within the normal range, it is unlikely that supplementation will lead to drastically better APGAR scores. However, APGAR scores are an assessment of newborn health immediately after birth, and the effects of nutrition might influence infant mental and physical health later in life. The association between supplementation and infant temperament could demonstrate that infants who receive supplements in proper doses of folic acid, while more reactive, may be demonstrating greater engagement and sensitivity to their environment, compared to under-supplemented babies who are potentially more lethargic and are less reactive and engaged with their environment. I would like to thank everyone who was involved in the study and data collection process, as well as my 2 primary investigators, Dr. Ablow and Dr. Sullivan. Thank you for listening to me discuss my research.